Mbali, just check if you can see me on my camera. Is my camera on now?
Morning, Chair. No, it's not on.
Uh, okay, now it's on.
Yes.
I don't. Okay, thank you very much. Okay. Mr. Monaco, can you switch off your camera for now? Thanks.
Okay, thank you, Chair.
Mm. 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 Why is it like so? Mhm. Okay. Okay, much better now.
Recording in progress.
Good morning, honorable members. Good morning to our staff. Morning to those who are presenting today on this program that we are involved in. Can we start our day by a moment of silence and the meditation, please? Okay. Thank you very much. Good morning once more, and let us start on this program that we are involved in. This meeting, honorable members, is assumed to be taking place within the precinct of Parliament, and therefore will be conducted within the rules and of Parliament, as you might know them. So we are familiar with those processes. For those who are joining us, participants by listening, it's only honorable members who will be interacting with the presenters. We are on this tobacco control products and electronic systems delivery bill that we are navigating through the challenge, the presentations. Today we have got two presenters. One is a Japanese, something's a long name. It's somebody who probably come from Japan, who's got an interest on this bill, and another one is a Center of Excellency. We'll come to that when they do present and indicate their names. But let me start by requesting Ms. Machalamba to indicate honorable members who are present today in this meeting.
Good morning and thank you, Chair. Present is Dr. Lomo, Ms. Kreko, Ms. Sine, Dr. Leroux, Mr. Mutubatsi, Mr. Mchatu, Mr. Van Staden, and Dr. Litlape. I've received an apology from Ms. Clark. Thank you, Chair.
Thank you very much. Honorable members, may I make two announcements with regards to ourselves as a functioning portfolio committee. On Sunday, Honorable Clark, Honorable Mutubatse, and myself will be joining a meeting from Sunday till Wednesday in Gauteng, a meeting that is organized by the UK parliamentarians who are interested to look into HIV/TB replenishing programs in the world. And we have been invited by them, logistics and all that arranged by themselves. There are some civil society leaders who will also be there. I'm not sure that the department will also be part of. That meeting will then also take place in September in London, and they also have requested that those members who will be attending this week also to attend the one in London in September. Is taken care of by themselves. Honorable members, it is something that maybe must begin to come to us as to, we do not say on the budget, we don't agree with this budget because there's poor allocation to TB, HIV, and all that. So we begin to engage the department to say, what did you have last year? How to improve on that? So it's dedicated mainly to advocate and really get parliamentarians to be interested to improve budgets within their countries, but also urge those who can be able to support like we call it, is the replenishing. There is a target of budgets to be replenished for those programs. Common things happen commonly. So these things are commonly in the world, and therefore advocates for that improvement. So that meeting will be looking into that, not only just South Africa, how there could be collaboration to strengthen advocacy for improvement of the TB HIV allocation. The second one, we and Ms. Machalamba have then sent a request to have this portfolio committee taking a tour to one of the countries, one or two, but we have indicated the one country that has been talked about by many presenters and something that we have had being Sweden, again, that is in Europe. We had to indicate now because, as you know, we are between a recess or constituency period, so that when we come back on the 2nd of September, the office of the House Chair should be responding, because we can't have that study tour later than somewhere in September. It is the month of September where this bill would probably be done close by this portfolio committee, probably before or after, more relevantly, after we have had a tour of that particular country. So we already have submitted the request, and therefore, if it is agreed upon, then we will go. The proportionality of members going on that portfolio committee will be determined by the rules of parliament and the allocation thereafter, and that will be communicated to the honorable members on time. Those are the announcements I wanted to make into this meeting before we start. Okay, can we then invite the Japanese long name initiative that is here to present? Some of them don't look like Japanese. They will have to tell us how they are and what's happening. You are allocated from 10:05, 30 minutes to make your presentation. Thereafter, you will be interacting with these honorable members who would like to engage with you in terms of questions, clarity seeking, and then you'll come back again to respond to those questions. So your 30 minutes start now. Welcome.
Chairperson, before we start, I just
Yeah.
want to notify you that I am on the virtual platform. All right. I'm navigating 2 meetings.
Say it again.
Chairperson, I am on the virtual platform, but I'm navigating 2 meetings. So if it comes to questions and I can't ask, I'll send them to Dr. Leroux.
Okay, accepted. Thank you very much.
Thank you, Chairperson.
Okay, right. Okay, our presenter can now start.
Chair, we're still trying to load the presentation.
As long as you know we are already chowing on your time, it's fine with us.
Chair, the host has disabled the video or the presentation screening. Can they help us out there?
According to my screen, you are a co-host. You are. What has been enabled on your side?
So when I'm trying to load my presentation, I get a message that says host disabled attendee screen sharing. So I can't load my presentation.
I'm not sure what is happening. Let me try and share from my side.
Thank you.
Why is it saying? Oh. Can you try and share now?
Okay. Can everybody see the presentation?
Yes.
Yes.
Okay, thank you very much, Chair. Good morning, everybody. My name is Monako, and I'm representing the JTI team. I'm going to take you through our oral presentation to the Portfolio Committee on Health. Please confirm again if you can still the screen. JTI, we are a company that has a very strong purpose of creating fulfilling moments and creating a better future. We were founded in 1998 with a very rich Japanese heritage. Our company sells products in over 130 markets with a goal of bringing exceptional tobacco and nicotine experiences to our consumers while evolving to meet their changing needs. Chair, we have a very broad category of brands that are sold across the world. Our portfolio includes brands such as Winston and Camel and Mevius and LD, but specifically to South Africa, JTI has the very famous brands Winston and Camel. We are also a company that produces reduced risk products, which is Plume, Logic, and Nordic. But then these products are not marketed in South Africa, but elsewhere in the world. The JT Group is what we call Japan Tobacco. The company was established in 1985, and 33% of its share belongs to the Japanese Ministry of Finance, which is the major shareholder in the business. The company as a whole has about 53,000 employees, including employees within the JTI Group, which is Japan Tobacco International. JTI in South Africa, we are a company that has had a presence in this part of the world for over 30 years. We have over 156 employees, 44% of which are female.
Can't hear anything now. I don't know if I'm the only one in that position.
Female. That was the last word.
I can't hear either.
So many are female. That was the last word you said to us.
No, we can't hear anything, Chair.
Can you hear me?
Start from
Yes, we can.
So many are females. Start from there.
All right. But then can everybody hear me now?
I'm reminding you where you ended.
Yes, I can.
Okay, thank you very much. Yes, 44% of which are female. We are a company that has been recognized as a top employer in Africa, globally, and in South Africa for 11 years consecutively. We are also a company that has been recognized in 2024 for our best engagement scores that has placed us 10% in the top 10% of companies globally. Chair, I would like now to hasten quickly towards our submission in the interest of time, seeing that we've lost a couple of minutes. I'll start with the overview. JTI, Chair, appreciates the government's desire to enhance the regulatory regime for tobacco control in South Africa. And we are committed to preventing minors from obtaining and using tobacco products. However, we feel that the proposed new law contains many disproportionate measures with widespread negative effects and unintended consequences. Albeit necessary, Chair, we believe that this regulation should be based on factual evidence that proves that its efficiency to generate health benefits. Therefore, JTI has reservations about this the introduction of the proposed bill, because it might, amongst other things, lead to the growth of the illicit trade, which currently sits up at about 75% of the current consumption in South Africa. And when you actually look deeper into the channels, Chair, you realize that when you look into the informal market, this number grows exponentially, with the recent estimations ranging between 78% and 80%. Our general comments are thus: the international best practice requires that a regulatory proposal should meet certain standards before a bill can be adopted. So therefore, regulation must clearly define the problem it aims to address. And we feel that it needs to provide credible evidence supporting the need for the regulation. And it needs to ensure that the socioeconomic impact assessment for the 2018 bill is out. Sorry, Chair, let me go back to that point. The socioeconomic impact assessment for the 2018 bill is outdated and does not reflect the increase in illicit post-COVID-19 tobacco ban. We feel that the bill should ensure that the impact assessment is accurate and complete, especially if significant measures are involved. And regulators must review and evaluate existing laws before introducing new ones. And then finally, the proposed regulation must be enforceable and applied equally and effectively. So the aspect of the bill, Chair, that we'd like to focus on specifically for JTI is the illicit trade in South Africa, the minister's discretionary lawmaking powers, the banning of ingredients, additives, flavors, and colorants, plain packaging, display of point of sale, and the extension of the smoking ban. Chair, I'd like to draw your attention to the illicit trade and how it's affecting the tobacco industry in South Africa. This slide presents the impact of illicit cigarette trade on tax revenue in this country. When you look at the slide clearly, you realize that in 2019, just before the COVID-19 pandemic, illicit trade was sitting at 36%, with an estimated 13.4 billion in tax losses, which, when you look at it again from a comparison perspective, with the Department of Home Affairs budget that year, it means the government lost so much money in comparison to the budget for the Department of Home Affairs. And in 2020, during the height of the COVID-19, illicit was sitting at 60%, with a tax loss of 21.3 billion, which is almost the same as the budget for the Department of Labor. Chair, South Africa is facing an escalating crisis in the form of illicit cigarette trade, which has eroded government tax revenue at a very alarming rate. This picture here, Chair, is a picture that is very dire, because in South Africa in 2025, the number for illicit has grown up, and the government is estimated to lose about 28 billion. So in conclusion, I'd like to reflect on the impact that illicit is really having on our the tobacco business in South Africa. The unchecked growth of the illegal cigarette market not only undermines public health goals, but also represents a massive drain on the national fiscus, is crippling the state's ability to fund essential services. Therefore, we believe that urgent coordinated enforcement and policy reforms are needed to reverse this trend. Chair, we also like to focus on the minister's discretionary lawmaking powers. We feel that we believe that the bill, as it is at the moment, is a bit vague. The bill gives the minister broad lawmaking powers, but it lacks clear guidelines to prevent the misuse of the power. We know that the legislature is the primary lawmaking power in South Africa, and that it can delegate subordinate lawmaking powers to other functionaries. However, there should be more limits or rules on how broad powers are used so that people affected by those decisions can understand what matters in making those decisions and when they have the right to challenge a decision that goes against them. Therefore, Chair, the law must guide how power is used to protect people's rights and prevent abuse. Chair, we also like to move quickly to the section on blending of ingredients, additives, flavors, and colorants, with a view that ingredient bans may increase the illicit and counterfeit market, and that ingredients don't make it difficult to quit smoking. Therefore, limiting ingredients could actually hinder tobacco harm reduction efforts that the government is trying to achieve. So there's no specific proof that banning flavors changes smoking behavior. And as a business, we believe that bans may lead to more illegal trade and criminal activity. Therefore, it is our view that bans would also limit trade and reduce competition and restrict consumer choices. On plain packaging, Chair, JTI believes that the introduction of plain packaging will cause material harm. We feel that the ban on packaging deprives tobacco companies of branding and reducing product differentiation and competition. We feel that plain packaging may increase counterfeiting and illegal sales, leading to revenue loss to the government, health risks from low quality products, difficulty in preventing youth consumption, and a rise in smuggled tobacco. South Africa, Chair, as I've alluded before, faces a high illicit trade problem, which is currently at 75%. And also, as I alluded before, to say, when you look deep down into the channels, especially the informal channel, you realize that this number is higher than what is estimated. We are also aware, Chair, that countries like Australia, France, and the UK saw illicit trade increases after adopting plain packaging. We are therefore concerned that plain packaging will lead to illicit trade. On health claims or health benefits, there is no clear evidence that branded packaging increases tobacco use. The socioeconomic impact assessment does not even support claims of reduced consumption. And again, when you look at other countries under this category, have not seen any reduction in tobacco use due to plain packaging. On the display at point of sale, Chair, we as JTI believe that the ban will potentially cause material harm. We feel that the ban could promote illicit trade by undermining enforcement. It might limit informed purchasing decisions for adults. It might harm competition and brand switching, while disadvantaging smaller manufacturers. A ban will impose compliance costs on retailers, especially the smaller ones. That is why we do not believe in this bill's effectiveness. There is no evidence, Chair, that display bans can reduce tobacco consumption. Again, the socioeconomic impact assessment doesn't support this display ban as an effective measure. And evidence from other countries still shows that there's no reduction in consumption from display bans. But I'd like to quickly go into the trade that we have in South Africa, the trade landscape, Chair, particularly around the display ban. When you look at this picture, the informal trade makes about 66%. And when you look at the formal trade, which is the legal tax-paying trade, is only 8%. When we impose this bill is only going to hit the formal trade and leave out the informal trade, which currently is not affected by the ban or will not be affected by the ban. A display ban is ineffective in the informal trade due to the poor enforceability, rampant illicit sales, limited influence on consumer behavior, and lack of regulation, making it a weak tool for tobacco control. On the extension of the smoking ban, Chair, a blanket smoking ban, even in designated compliant areas, will harm the hospitality industry and discourage smokers from visiting restaurants, bars, and entertainment venues. It will impede investment and potentially cause heavy job losses. The focus should instead be on enforcing existing public smoking regulations, which already balance the rights of smokers and non-smokers. When you look at the impact that a ban like this could have on job losses, Chair, you realize that our country is in a dire position from an unemployment perspective, and the continuation of such a ban could actually result in an increase in national and youth unemployment rates. Our closing remarks, Chair, we'd like to emphasize the risks that this current bill presents. It will not meet the desired objectives. Instead, it will exacerbate the illegal trade and have direct and disproportionate economic impact to the hospitality, restaurant, small and large retailers, and the whole value chain. There are overreaching powers being afforded to the minister, which impact the principles of consultation. Existing tobacco laws need to be enforced first before making additional regulations, which will have the opposite compliance impact. We believe that there's going to be an increase in already high levels of illicit tobacco incidences. The bill will reduce the already shrinking legal and tax-paying tobacco market. The bill will reduce the taxes paid to the fiscus. And non-significant or outright no improvement in health outcomes are going to be brought by this ban, by this bill, as consumers will continue to switch to illicit tobacco brands, which may be more harmful to them. Thank you very much, Chair.
Okay, sir. Thank you very much for your presentation. I will now open up the opportunity for honorable members who would like to who want to actually engage. In my platform, I see honorable, in this order, number 1, Honorable Van Staden. Number 2 will be Honorable Chirampungose. Can I scroll up? Oh, God. Okay, I can't scroll up here now. There's another hand. Miss Machalamba, assist me. My computer is refusing to show all the names. Number 2 is Honorable Chirampungos, and what is number 3?
Dr. Leroux, followed by Dr. Letlapa, Chair.
Dr. Leroux, we are number 3. Dr. Letlapa, we are number 4. Is that
Mr.
where it ends?
Mutubatse,
Eh?
Mr. Mutubatse,
Mr. Mutubate, you are
following
number
Dr.
5.
Letlapa,
Yeah, number
and
5.
Ms. Murray. Ms. Murray,
Number 6.
yes, Chair, and Ms. Sene.
7.
Yes, Chair. 1, 2, 3, 4, 6. Yes, yes, Chair.
Okay, honorable members, in that order, all I can remember that is Honorable Van Stel is number 1, Honorable Chirampungos is number 2, Honorable 3 is Honorable Leroux, is that Dr. Number 4, Honorable Dr. Letlape, number 5, Honorable Mutubatse, number 6, Mare, and then 7 is Honorable Sine. In that order, please, honorable members, one after the other. Thank you.
Including me, Chair, Kaiko.
Who's that one? Kweko.
Yes,
Okay.
Chair.
Number 8, Honorable Kweko. Thank you very much. Any other one that I might be leaving behind? My gadget is not doing well. Okay. In that order, honorable members, one after the other. Honorable Kweko, you are number 8. We are following Sine. You always wonder whether you are now next to come. You are after Sine. Thank you.
Thank you, Chair.
Thank you, Chairperson, and thank you to the presenters for the presentation. It's much appreciated. We all know that the illicit trade in South Africa is a huge problem and it needs to be addressed. But can you tell me what have your company done on your part to address the illegal trade in cigarettes and tobacco in South Africa? That's my first question. My second question will be, what will you see will be the solution to curb the illegal trade in tobacco and at the same time take into account the health of South Africans? And my third question is, do you think that enforcement has been successful in general when we see that 60% plus of the market is illicit? Then on the other hand, you've been spoken about other countries, but I want to know from you, what is other countries in the world doing differently in terms of tobacco legislation, more different than South Africa that we try to do at the moment? If you can just give us some information on that. Thank you, sir.
Thank you, Chairperson. Greetings, colleague. Greetings to the staff members and the JTI. Thank you so much for your presentation. Chairperson, I'm having an issue with the assertion that there is no scientific evidence on how banning of flavors. Firstly, I'm Naledi Chirampungose from the EFF. I'm having issues with how they are saying that there is no scientific evidence that proves that banning flavors reduces or impacts smoking behavior, because there's a few studies that actually prove otherwise. The Chaitin et al. 2020 tobacco control study that is titled Association of Ban on Menthol Cigarettes with Smoking Cessation Initiation Among Youth and Young Adults in Canada, that evaluated youth between 12 and 17 years old, saw a 2% decrease in overall smoking prevalence amongst young people, right? And secondly, there's the Friedman American Journal of Public Health titled Effects of Flavor Ban on Electronic Cigarette Use Among Adolescents in San Francisco, that saw a 20% reduction in vaping prevalence amongst high school students aged 14 to 18 within a year. Despite some other youth going and obtaining flavored e-liquids from unregulated sources, the amount is still quite low. There's still a 20% reduction that emanated from that, right? And then thirdly, the CADHAM journal titled Nicotine and Tobacco Research, Impact of Flavor Bans on Tobacco Products Use Among Youth in the United States. It also saw a reduction amongst youth aged between 15 and 20 with the flavor ban. the Kingsley Journal of 2021 on adolescent health, titled Flavor Tobacco Product Restrictions and Youth Tobacco Use, Evidence from Massachusetts, also found a reduction. It found a 12% decrease in overall tobacco product use. And this study actually showed that the ban particularly was effective in deterring initiation amongst non-users, right? Flavored products also fell from 16% to 4% amongst young people post the ban. And quitting attempts increased by 10% amongst current users. Ne? The CADHAM study in 2022, nicotine and tobacco research, was quasi-experimental difference in analysis of state-level e-cigarette flavor bans, and the population that they were studying was aged between 12 and 17 across the United States. And their sample size in these studies with the CADHAM group is 50,000 annually. So I really want to find out from JTI, why do they say that there's no scientific evidence on that amabenoma flavors has no impact on smoking behavior? I mean, you can ask a lot of smokers, especially young people, they don't want to smoke just non-flavored tobacco and nicotine products. So it will have an impact on smoking behavior. Even if we did our own domestic study, this would be the case. But more so, there is actually scientific evidence. So reconcile us, because I don't take kindly, Chairperson, through you, that we're being misled on studies that are available to everybody, to be told by JTI that a ban on flavors, for example, will have no impact on smoking behavior. Please correct that, because there is evidence, the scientific evidence, and you can't mislead us on this. Like, rather say something else, but don't say something that has tangible evidence that we can pick up from journal articles, studies that have been done and approved, and come to the Portfolio Committee of Health in Parliament and mislead us on that one item. That's my only comment and question. Thank you so much, Chairperson, for the opportunity.
Thank you, Chair. Can you hear me?
Yes, you can hear you.
I'm glad you can hear me this time again. Thank you, Chair, and thank you for the presentation. I just had a few questions to the Japan Tobacco International. You mentioned in your presentation that you were concerned that there was too much power in the hands of the Minister of Health, and it's an issue that's been raised by other presenters as well. What would you suggest would be a better approach in terms of the legislation to take some of that to not concentrate the power in the hands of one person? So what is your alternative suggestion to the legislation in that particular instance? I mean, also, if there is anything else that you feel like you would want to add or remove from the existing bill, would you please let us know what that would be? Then just in terms of you spoke a bit about the illicit trade. What is your experience as a company about with regards to law enforcement and the policing of the illicit trade? What is your involvement in that, and what has your experience been of that? And then just wanted to get a sense of your perspectives on how electronic products, so non-combustible products, should be regulated, and also just a sense of, I mean, how you are, as a company, are trying to make your products safer for consumers. Yeah, so if you could just get back to us on that, I'd really appreciate it. Thank you.
Thank you, Chair. I just want to do biometric verification that it's me. My questions are around what has been raised around flavors. I hear people talk about banning. Can you comment on the issue of banning or restrictions? And if you agree with restricting flavors, what regulatory framework would you propose for flavor regulation? Now, there's the issue about youth uptake, but there's clear recognition of benefits to adults. My question is, with underage smokers, and there's plenty of them in our country, should we be exposing them to supposedly less harmful alternatives if they are already into cigarette smoking or not? Remembering that the impact on health of smoking is duration dependent. It's after years of smoking that you're going to have the severe health impact. So we should not undermine the duty we have to assist adults who can't quit or choose not to quit to reduce harm to themselves. Those are my only questions, Chair.
No, thanks very much, Chair, and we welcome the presentation. You spoke about that the department has not conducted an impact assessment. Have you done that? And if you have conducted that impact assessment, can you share with us what are the outcomes of those of the results? Secondly, and I want to indicate throughout you have been talking about banning, and the intention of the work that we are doing as a parliament and as the portfolio committee is not talking about banning. Where do we get an idea that the bill is intended to ban? And also, you mentioned that their overreaching powers are allocated to the minister. Can you lift those areas that are overreaching so that you can help us? And also, how do you what do you suggest as an alternative around that area of overreaching that you mentioned? You spoke about minors. How do you prevent minors to have access to cigarettes? And what is your view on the vending machines? Because those vending machines, anyone can have access to it. What is your take on the vending machines? And which areas in the bill are an impediment to you, and an impediment to what? Because I've not heard you coming out clear. You've been talking about the bill banning and the impediments, but what are the alternatives that you can share with us in that regard? Thanks very much.
Thank you, Chairperson. The speaker just before me took all the words out of my mouth because I also wanted to understand the banning problem. Because I heard the same discussion yesterday about the banning. And then the packaging, I would like to know about the packaging. You were talking about the banning of the packaging. What will be the impact if there is no, if there's nothing on the package? Because yesterday the person was saying it can go for legal advice because each one is having his brand. Are you of the same view? And then I also want to know about the illicit cigarettes, because yesterday for the first time, I always thought illicit cigarettes is coming from other countries. And the gentleman yesterday said, no, it's coming from South Africa. It's been manufactured in South Africa. So I want to understand, like the first speaker was asking, he said, what are you doing about this illicit cigarettes that's been produced and manufactured in South Africa? And how are you controlling that one? Because your speech was about the illicit cigarettes and how it's going to how it's having an effect on your company and what your company is doing. And I also want to agree with Honorable Naledi is that if you look at this flavor things, even the children that is smoking this oka pipe thing, you will go to the tuck shop and you will hear the children know the names of the flavor. They will tell the guy, I want this one and that. And I will always look at the children and see, no, that one is not nice. Give me the other one, you know. So it looked like these children are really going for these flavor things. And if you say that the flavor is not going to have an impact, I also would like to understand that. But my most concern is this thing about the ban. And like the previous one was saying about the ministers going to have too much power. What is the reasons that you are saying these things? And what are your company doing about this illicit trade that is happening in our country? Thank you, Chairperson.
Thank you, Chairperson. Let me also acknowledge the presentation. JTI, there are concerns from some people in this country that presentations like yours and others who are not from South Africa must not be accepted and must not be allowed to influence this piece of legislation that we are dealing with. This country has been engaging in the tobacco legislation process as far back as 1996. And yes, that followed thereafter. Is this the first time that you are engaging with this committee, or you have done it before in the past administrations? What do you say to this nation that your organization and others who are not from South Africa shouldn't have a say in processes like this? Number two, Chair, you mentioned that you are having problems with ministers' powers in the bill, but the current Tobacco Control Act also gave the minister powers to make regulations because that is the minister's mandate. Are you saying we must change our constitution because you don't want the minister to carry out his mandate as it concerns tobacco control? My third one, Chair, we are in this process for the best interests of the people that we are leading, the people of South Africa. You are raising concerns. You are raising concerns about the extension of a ban in public spaces on the basis of loss of revenue. What about the health of non-smokers in public places, such as your restaurants and others? What about the health of the workers in such public places? We know that they can't speak out for themselves, fearing intimidation and expulsion by the owners. But what are you saying about public health in those public spaces? And lastly, Chair, claims that plain packaging increases illicit trade are not backed by credible global evidence. So the real motive behind opposing the real motive behind, is it to keep tobacco products appealing, especially to young people? Because our reason for not supporting plain packaging, if you have seen what the current state of packaging does, each and every corner, a young person is having is vaping because of they get attracted to those colorful strawberry colors. So yeah, those are my questions, Chair. Thank you.
Thank you very much, Chairperson. Let me appreciate the presentation from the TJT group. I wanted to say we appreciate that the group is appreciating what we are doing, regulating of tobacco products. He has said it is necessary, but they are raising a concern about illicit trading, which is also our concern as members of parliament. But my interest would be, when did they start being so concerned about illicit trading? Because, Chair, in my mind, I think some companies are also participating in that space of illicit trading. But since we have introduced this bill, they have started being so concerned about illicit trading. It's good that the presenter is recommending a coordinated enforcement around illicit trading. That is what is happening even now, but as a government, we need to do more so that we prevent this high number of illicit trading. But the 78% that he is saying on illicit trading, I don't think, I doubt if it is the situation. I would want to ask the accuracy of that percentage. It is so high. It's reflecting that by 2019 it was at 36, 2020 60%, and 2025 at 78. That is why I'm asking, what were they doing from that lower percentage to this higher percentage? What contribution, what advices do they put to the government so that there is not this high percentage? Also, Chair, I have a concern when these international companies, like the Japanese company that he is representing, is making directives to a South African government on what to do, on what to regulate and not regulate. But some companies before this company were raising concerns about the presence of NGOs and other interested bodies that seem to be assisting South Africans around this bill and around tobacco control in South Africa. Coming to the issue of flavors, other member MPs have put it right to say flavors attract younger ones and those that have reduced their consumption in tobacco, because flavors will lead to addiction. And also on the plain packaging, I think we are on a right track, Chair, on plain packaging, because the brighter the color, the more attractive is what is on sale at that time. Yes, it's a marketing strategy, but if you put a black, a white, and you put a green, a red, a yellow, anyone would first look at the brighter one than the darker one. So that is why there is this mention of a plain packaging in the bill. On the issue of display, when you want to attract younger ones, you can see the strategy of business to put sweets, to put chocolates, whatever, next to the tills. So is tobacco. It is there. That's why even if one has forgotten to buy, when you are about to pay, you see that, oh, there's sweets, there's this, and there's tobacco. So you start buying. If they are saying that will not result in health benefits, I don't think they understood well the objectives of this bill, because it is introduced as a health benefit, because it seeks to address the health issues of individuals. Around the issue that the existing laws must first be enforced before making an additional regulation, I think we must do both, Chair, to save time and save health of others. I don't think there is no enforcement. There is enforcement, even if it has got its challenges, but there is enforcement. Like, there are places where you are not allowed to smoke. It is there, it's reflecting. I'm worried when they are saying there must be no ban in public places. What worries me is the pollution and also the health of non-smokers. Member Sene has put it well to say our concern is around people who are working there. Our concern is around those that are non-smokers, but they are there because those are restaurants. That's why we think it is good to regulate these tobacco products. And also the fear around the minister's powers. I wanted to bring to the that ministers are accountable to Parliament. And us as members of this portfolio committee are members of Parliament. And our primary duty is to do oversight over the departments that account to us. So there will be no free ride. Minister with powers will account to Parliament, which we are members of. I think, Chair, my real concern is around this issue of most international companies being interested in making directives to South African government. I would like the presenter to make examples of countries where these powers are not with the ministers. What is the situation in those countries, if there is information that he can share with us? I think, Chair, let me stop there for now. Thank you.
Okay, thank you very much, honorable members. Let me add my contribution here. I hope I'm not a robot. Yeah. Let me add my contribution to what members have said. Firstly, Mr. Monaco, it's very unfortunate that there are certain statements that you made, which to me are very, very being insensitive. Your major shareholder in this company is the government of Japan. You mentioned it that the Ministry of Finance is a major shareholder of your company. Now, it's undiplomatic for any country, for any ministry to tell another country how to behave. That should have come from any other presenter other than yourself, because you are actually here speaking on behalf of other major of your shareholders. One of them is being the Ministry of Finance in Japan, telling a Minister of Health in South Africa or a country of South Africa how to behave when we are making laws. That should not have been part of your presentation. It was insensitive and undiplomatic, because here you are dealing with these issues in that way. So other members have raised it, but I wanted to be that direct to you to say it was very insensitive and undiplomatic for you to raise this issue, because not only are you having an international flavor of being in Japan, but you have a major shareholder being a government of Japan telling another government how to behave. That one is very unfortunate you raised that matter. You then say you read the bill very well, and on the bill you are picking up that the minister is going to do this, that, and the other, but you misread the bill when it comes to the banning of flavors. There's an issue about restricting flavors and probably not ban them. If you want us to ban them all, that's fine. But if people want nicotine, they should, within the confines of those restricted flavors. If you are saying restricting or banning flavors will do harm, of course it should, if it can, and reduce the interest of those who are actually going to be using those issues. You can't say you are going to actually sell better if you have the vapes with vanilla or with chocolate. You can't sell it better when it is without those. Now, and you are actually emphasizing the issues of how you would raise less cash compared to if they were flavored. So that part, you probably should leave it to the committee to say, you could already be saying you probably are concerned, but there's no issue of banning of flavors, rather restrict some flavors there. That part the committee might do. Of course, this bill is pro-health, and I would imagine you had no interest to raise issues that you pick up in other, because as a South African, you could have picked up what South African Medical Journal is saying about reducing so many deaths by avoiding so many smokers. Do juxtapose that, do learn. Don't also be driven by the profit focus and not be interested to say, by the way, what is this bill trying to do in terms of health of the citizens of the country? And you then further have a challenge on the issues of restricting the areas where people can smoke. And there is an act that talks to that, but that one we would like to improve, because already smoke is smoke. It also does go to areas where you think it is reserved for non-smokers. So that part is something that actually it's a matter that should be, I mean, look, the act that we have has something to do about restrictions, but that has been found not to be adequate enough, and therefore needs to consolidate that and make sure that we are even improving and giving people more and more access to places that are without a smoke. So you are concerned about the extension of banning public places on the basis of loss of revenue. You are not saying anything about the health of non-smokers in public spaces, because that is where you actually find, maybe one is actually putting very strongly to say, some smokers are probably enjoying what they do and not being considerate for non-smokers. Are you also aware that studies around the world and also in South Africa showed that smoke still gets to non-smoking areas? Are you probably aware that no engineering ventilation systems currently exist to prevent smoking from drifting to non-smoking areas? So that we could then give the respect to those who smoke, and also recognize that there are people around them who do not smoke. Okay, can we then get your responses on these questions raised by members? Thank you.
Thank you very much, Chair, and I'm much mindful of the time. But one thing that I need to clarify from the word go is the fact that we are a solely South African business. We are registered in South Africa, and we are 100% a South African company. We do not represent the Japanese government. They are part of the JT Group and have a 33% shareholding. But in South Africa, we are solely a company registered in South Africa. I think that is important to, as a start of our discussion, Chair. I needed to clarify that up front. And when we focus on the minister's powers, we believe as JTI South Africa that there needs to be clearer provisions within the bill itself. There needs to be more consultation. And then also, so we need to sort of see how the bill has sort of exhausted the consultation process. I think that's quite important for us as a business. On the flavors and the banning topic, we need to first of all clarify that in South Africa, the JTI business is in the cigarette business. We are not in the vaping business. So when you talk flavors, when you talk flavors, Chair, we are, and I sort of heard other members were talking about flavors. We are not in the reduced risk business in South Africa. We don't have a category in South Africa at the moment. we are solely talking about cigarettes. And then I need to also emphasize this point, Chair, that we are a company that is registered in South Africa. We are a top employer in South Africa and recognized as such. And then we are on the top 30 taxpayers in South Africa. On the matter around illicit, we have had a very long-standing relationship with SARS on enforcement. When you look at the recent Ipsos study that was commissioned by our counterparts, you'd realize that JTI was not highlighted as, JTI products were not highlighted as part of the illicit trade. And that is as a result of all the interventions that we've had in our facilities to ensure that our products are not part of the trade. But on top of that, I think it needs to be highlighted, Chair, that we are members of, or we take part in activations and sort of affiliates within the CGCSA, where there is a concerted effort to drive, enforcement on illicit. And our efforts are, they're not necessarily paying off at the moment, but then we are working with institutions that are trying to push the enforcement from where they are. But I need to also emphasize again, Chair, that the mandate of enforcement lies with the law. I mean, the police. We do not have the necessary sort of aptitude to fight illicit ourselves. It is the mandate of the police, and we feel that at the moment it's lacking. So I'm going through the questions, Chair, because there was quite a lot of them. Okay, on the matter about the socio-economic impact assessment, we cannot do it ourselves. It needs to be a process that is done, obviously, prior to putting forward the bill. It needs to be done by other parties, but we are not in the position to institute one ourselves. Sorry, Chair, I'm still on record. I'm going through my responses.
Mind your time. You are
Yes, Chair. I'd like to call one of my colleagues to come through and respond to one of the questions.
So yes, good afternoon, committee. Just to clarify on the issue of banning.
It's still good morning. It's still a morning.
Morning. So the clarification we just wanted to give was that in terms of when members were asking about banning, and this touches on the aspect in terms of the scope of the powers of the minister. The powers of the minister are quite broad, and the range of powers, the scope is quite broad. It goes from regulating to banning of flavors, display of products at the point of sale, and packaging. So that's where those concerns arise, and that's where the concern comes in terms of this aspect of banning. Reference was made in terms of the flavors by the first for the second lot of questions. The studies you refer to, when you said the studies, you referred to a bunch of studies from the US. Those studies, we can't really comment and challenge on them because they refer to vapes. Those are studies done on e-cigarettes. Our business is cigarettes, and therefore our reference points are cigarettes and what's happened in markets that have banned cigarettes, like the UK, like France, is where we've seen these trends. We don't challenge what you said in terms of the trends and the studies that have been said. We can't comment on those. We don't have that expertise in terms of that. But the reference points we were making was that the experience we've seen when it comes to the banning of cigarettes is where those studies happen, where those incidents happen. And the concern is also that when you do such, you also result in unintended consequences. So the objective you're trying to achieve isn't quite achieved, but the other things that are achieved in the process, this being an increase in illicit trade. So the demand for those cigarettes doesn't go away, doesn't fall away. If anything, it just goes and it fuels the already existing illicit trade market. So that's where that concern arises. And if I think in terms of, just to re-emphasize the point on illicit trade, I think as a company, we have for many, many years now engaged with the relevant committees on this and with SARS, and we've partnered with SARS. Our proposals with them is that there's a need to increase the level of enforcement, because the issue is really one of enforcement, and it's not happening. So Minister of Finance in his budgets speeches earlier this year set aside money to try and tackle the scourge of illicit trade. So there is even an acknowledgement in government that of the problems that arise from illicit trade. So enforcement is what's needed. There are a number of other measures that we've seen used elsewhere, but I think if you go in with minimum retail sales price, that would be a bullet that could actually deal with this. But that in itself would need to be coupled with enforcement. So you can bring in a number of measures, but the enforcement is really key.
Thank you very much, Chair. And also just to respond to the issue about youth uptake, we are, as a company, very committed to cessation efforts to get people to quit if that's their wish. And then I think I need to reiterate the point that we made at the beginning, that we are a company that is registered in South Africa, and that we do not necessarily represent the Japanese government. We therefore are, subsidiaries of a business that is JTI International, in which the Japanese government has a stake or a shareholding. But then in South Africa, there's no particular influence. Oh, Chair, there was another question that I'd like to address quickly, which came from the honorable member that said, do you think enforcement is successful currently? And the answer is an absolute no. Enforcement has been a problem on illicit. Hence, you see the escalation of illicit nationally, which is sitting at 75%. But then ordinarily, when you go down into the channel, you realize that when you go into the informal market, for instance, the rate of illicit is growing exponentially. And then there is no effort to curb it. In fact, when you go down to the trade, you realize that the traders brazenly put illicit cigarettes in the open, and there is no enforcement from authorities. This has a material harm in the sense that young people can easily access cigarettes from a stall where the current regulations are not even effective. And that in itself, Chair, it's an issue that the current policy on public health is trying to address. And this bill, is proposed to address such issues, but then it does not show that there's going to be any benefit from this proposed bill to address that part, so long as there's no enforcement.
Are you done now?
Yes, sir.
It's done.
Chairperson?
Yes, Honorable Mare.
Sorry to interrupt, but I just want to ask the last question because you say that they are a tobacco company. And if you look in our communities, we have the snuff, the snuff that the people are using. And you get the yellow tin and you get the black one and you get the blue one. I don't know what is the difference between that. And then you get the one that they call in Afrikaans the roll tobacco, where the people chew the tobacco and they spit it out. What is the health risk of those things? Because you hear people that is using the snuff will say it goes right to my head, especially when I have a headache. So what is the impact on that when the people are not smoking, but they are snuffing it and they are eating it? Thank you, Chairperson.
Honorable Mare, I allowed you, but I thought you were going to say there's one question you raised that was not properly answered to. Now, we normally don't do second round because if we do to Honorable Mare, then we must do it to any other member. Let's try next time to write down all what we need to ask so that we do one round so that we can mark time. But let me allow him to support you with the response on the question that we have raised. Thank you.
Thank you very much, Chair. We cannot sort of respond to that question because that's not part of our business at all.
All right. Honorable members, let us then accept the presentation and the response that have come in from the team. It may be a difference of opinion that the origin of what you are doing has some flavor with Japan, and at the end of it all, you may be based here, but the ideals come from somewhere else. So that is not something we can debate for long. Let us therefore accept that you have presented, and your presentation and responses will form part of the collective pool of responses that we as a portfolio committee will consider when we make a final determination. It shouldn't be that if you do not agree with what you have said, then we did not listen to you. It's just that in the overall picture, at the end of it all, we might amend this, that, and the other. The bill is with us as a portfolio committee. There may as well be certain things that we might add on or amend in the bill to make a final product as parliamentarians. The department is an initiator of the bill. We are the lawmakers, so we must look into what is best suiting South Africa in terms of this. Thank you very much for your presentation and have a good day. You may remain if you so wish. There's another presentation that is coming in immediately after your comments. Last comment.
Thank you very much, Chair, for the opportunity to present to the Portfolio Committee. We really acknowledge the participation from the members. We still sort of maintain that we are indeed a South African business, registered in South Africa, and part of the JTI group. We do not represent any interest from Japan. Government, I'm sorry, yes.
Thank you very much. Have a good day. Honorable members, we are now going to listen to a presentation by the Center of Excellence for the Acceleration of Human Reduction of Harm Reduction. It's University of Catania on its input on the tobacco products and electronic delivery systems. You will have to educate us as to where is this university, Catania, and also are you trying to assist us going forward? What has been your interest to contribute from that University of Catania, wherever it is in the world, to a product development of such a bill in South Africa? We hope that you will be able to also touch on that. You will have 30 minutes of your presentation. Thereafter, members will actually interact with your presentation, and then you'll come back to respond to those questions. Your 30 minutes now starts at this 20 minutes past 11. Thank you very much.
Good morning, Honorable Chairperson, honorable members of the committee, and distinguished participants. Can you hear me well?
Yes, we can hear you well.
Fantastic, fantastic. It's an honor to be invited to contribute to today's deliberations on the Tobacco Products and Electronic Delivery System Control Bill for South African people. I've been in South Africa many times. I really enjoy your country. I love it so much. I joined you today representing the Center of Excellence for Harm Reduction at the University of Catania in Italy. It is in Italy. Actually, it is in Sicily. So we share the same good weather. And we will do that with a focus on harm reduction research because that's our excellence and our skills. In my remarks, I will aim to provide evidence-based insights regarding the potential health implications of harm reduction strategies while aligning with the broader objectives of protecting public health in South Africa and supporting informed policy making for your government. Let me allow to share my slides. I took the liberty to shorten the discussion because I've seen that you had so much discussion before, and so I'll make it shorter. Of course, we all know that that the smoking problem is global, and you have, like in Italy, a very high prevalence of smoking. It is interesting to note that your smoking prevalence it equates the one that we have in Italy, in particular in Sicily, where I reside. I would like to try and provide evidence on three major themes. The first one will address the impact of tobacco harm reduction tools, in this specific case, electronic cigarettes and smoking cessation. Triangulation of systematic reviews and real-world evidence shows that e-cigarettes help smokers quit. And this is the evidence. I mean, probably you know already that the Cochrane Library is the highest level of evidence, and their conclusion is that people are more likely to stop smoking using nicotine e-cigarettes than using nicotine replacement therapy, specifically patches and gums. So this is all about very rigorous randomized controlled trials, because that's what it does. The Cochrane Library is a systematic review, pooling all the evidence. In this very latest release, they evaluated the 7 high-quality randomized controlled studies, and the conclusion is written here. So it is effective to help people quit smoking more than standard medicinal products. However, as I was mentioning before, randomized controlled trials are not really representing the reality of the smokers and their daily life. So it is best also to triangulate the data from randomized controlled trials with real-world evidence data. And I've selected this one coming from the US. It's one of the largest surveys. It is called the National Health Interviews Survey. And you will see in this slide what is the trend line in the prevalence of smoking in the US for this population of nearly 1 million of respondents. And you will see the trend line tends somehow to be reduced. I mean, there's an accelerated decline in the reduction in smoking prevalence, whereas at the same time, at around the year 2006, 2008, there is an increase in vaping uptake amongst this population. This is to suggest that vaping is basically replacing smoking, And vaping is very well known to be much less harmful than smoking because of the lack of combustion. In the same study, the authors were very clever to do some sub-evaluation in the younger population. And you will see for yourself that the smoking trend line and the decline in smoking prevalence accelerated in the US on the same time window. And this acceleration in smoking decline was paralleled by an uptake in vaping. This is to suggest clearly that the more vaping uptake, the more substitution of smoking. This has led basically in the US to near eradication of smoking among students in high schools and colleges. A second theme I would like to present to you is about health effects of electronic cigarettes. Of course, if you quit smoking, you will avoid exposure to more than 8,000 chemicals that are present in tobacco smoke and that they are responsible for smoking-related diseases. But, you know, quitting smoking is not an easy task. I've been leading smoking cessation centers for more than 25 years, and it's a frustrating job with a lot of relapses, even in highly motivated people. One solution of this problem is to, in those people who cannot or do not want to quit, to try and suggest them to try combustion-free nicotine-containing products. And of course, these products have been shown to have reduced emission, consequently reduce exposure, and it is very likely, given the toxicological profile, that this will lead to reduced harm. How can we evaluate the health improvement after switching? How can we substantiate this reduced harm in considering that epidemiology is not available there because these products have been introduced only in recent times? The approach can be multifaceted. So we can just look into in vitro cytotoxicity and mutagenicity studies, or we can just look into in silico science and recent epidemiological studies, or we can just evaluate clinical studies looking specifically for health effects indicators of biomarkers of potential harm. Let's start with in vitro studies, just a couple of slides. Let me illustrate what I believe is the largest replication project in tobacco harm reduction science. Why it is important to talk about replication? Because most of the studies that have been published in this space are not replicable. So in order to address this problem, the Center of Excellence has designed a study involving 5 different labs across the world. We use the same equipment, so same smoking machines, same vaping machines. We train the scientists and researchers in these 5 sites, one in Indonesia, one in Serbia, one in Oman, one in the US, and one in Italy, to perform the same standardized procedures. And if you look at the panel on the right-hand side of the slide, you will see for yourself, these dots just represents the different sites. And you will see that there is some variability. As I mentioned before, replication is problematic when we carry out the studies like this, even under the most stringent standardized conditions. But overall, if you consider 100% the baseline, meaning viable cells, anything below 100% is dead cells. And you will see that by smoking cigarettes, you are going to kill about 75% of the cells in these petri dishes. When you use tobacco harm reduction tools, there is very little effect. In some cases, the cells are actually growing. They're growing because in the petri dishes, in this culture, there are growth factors, and probably the effect of these vapors, of these aerosols, are not sufficient enough to cause cytotoxicity. In summary, these products are about 80% less toxic than tobacco cigarettes, and our findings are aligning with what has been shown by several researchers all around the world. Another important aspect that I would like to emphasize is these replication projects are also showing that electronic cigarettes are about 99% less genotoxic compared to tobacco combustible cigarettes. Another approach is to look at the epidemiology and in silico science. Of course, as I said before, we don't have enough, there's not enough time because electronic cigarettes have been introduced very recently. The epidemiology to show disease risk will not be enough. But there is a proof of concept idea that comes from Sweden. In that country, snus is an oral nicotine product that doesn't cause combustion. And there is a long-term snus use in Sweden, dating back the 60s and the 70s. And you see from this slide that Sweden has the lowest lung cancer mortality compared to all the other European countries, considering that in EU snus is banned. So they cannot use snus at all, whereas Sweden, because of a specific provision in their law, they can use snus, and they have the lowest lung cancer mortality in Europe, and they have also the lowest cardiovascular disease prevalence in Europe. There are also other approaches to test this evidence using in silico studies. For example, using lean systematic reviews. Systematic review process basically screens high-quality studies and then provides a summary out of the best quality studies that have been published. In this specific case, we conclude that smokers who choose to switch to electronic cigarette do not have additional cardiovascular risk, and they can benefit from this choice. In another similar systematic review study, we show that smokers who choose to switch to electronic cigarette do not have additional respiratory risk and can benefit from this choice. Another approach to substantiate health improvements after switching to tobacco harm reduction tools is clinical research. In my experience, I've learned a lot by observing people coming to smoking cessation clinics. And one of the first things that I learned from my patients was that just 48 to 72 hours after quitting smoking, these people were already enjoying the capacity of getting the taste of food again, smelling, it was back again. And this is probably simply because there is a reversal component in the sensorial tract of the nose and of the mouth. Using this idea, we implemented a saccharin test. In short, a saccharin test is introducing a saccharin tablet in the nostril, as you can see here. And then you ask the patient to keep swallowing for continuously until she or he perceive the sweetness in the back of the throat. The timing from the insertion of the tablet, of the saccharin tablet, until the subject can perceive the sweetness in the back of the throat is called mucociliary clearance transit time. The mucociliary clearance transit time can be prolonged in smokers, particularly prolonged in smokers, and the reason is because the cilia of the upper airways are completely damaged, as you can see here. Here in the electronic microscopy slide, you can see complete desertification of the cilia compared to non-smokers. So it is clear that if the cilia are not operating very well, it will be impossible to transfer the sweetness of a saccharin tablet in the back of the throat. And you will see here what happened when we compare current smokers here with never smokers. Current smokers, of course, have a very prolonged saccharin test transit time. It's more than 11 minutes. In this particular experiment, in this particular study was about 14 minutes. And never smokers, on the contrary, have a shorter saccharin test transit times. In this particular study was about 7 minutes. And interestingly, the 7 reduced saccharin test transit time is similar to that of former smokers, indicating, as I was learning from my own patients in the smoking cessation clinic, that this effect is totally reversible. Here you see what happens in people who completely stop smoking by switching to electronic cigarette or heated tobacco products. You can see the level of saccharin test transit times equates that of never smoker and former smokers. Another thing that I noticed in people quitting smoking in smoking cessation clinics, and they quickly refer an increased level of exercise tolerance. So
Hello,
I thought,
Professor.
yeah.
Professor, you are left with 7 minutes and you are nowhere halfway with your slides. We did not give you an hour. I see you've got
Thank you.
50.
Thank you. I will the end of the presentation is going to be relevant, so don't worry. I will make it quick. Thank you. Thank you, Honorable President. We use excellent exercise tolerance to measure anaerobic capacity, which is VO2 max. And this is just an example in one of our studies showing that smokers, the blue bar, have a reduced anaerobic capacity compared to former smokers and never smokers, represented here in red and green. Interestingly, in a prospective study of people who are switching to electronic cigarette, there is an improvement already at 4 weeks when you quit smoking by switching. And this improvement is maintained at week 12. So these people perform much better in terms of physical performance. In terms of smoking in patients means that people can walk up more stairs or can do more things in their daily life. Another important aspect that can be evaluated in simple terms is the improvement in respiratory symptoms. Here you see improvements expressed as this is a respiratory symptoms scores. And in smokers, of course, the scores are higher because they have more respiratory symptoms. But in former smokers who quit by switching, this level is substantially reduced. And these are more evidence from other studies. I will switch to something else. We've been talking about healthy smokers, but what about people who have already developed a smoking-related disease, such as in chronic obstructive pulmonary disease, such as COPD? This is perhaps one of the first evidence published in 2014 of a global survey in which 1,062 people with COPD stated that their respiratory symptoms improved in 85% of these subjects after switching to electronic cigarettes. We wanted to test this survey in a clinical setting. So we follow up for up to 5 years COPD smokers who opted to use electronic cigarettes. So we single out these people and we followed them up for 5 years. And we noticed a marked reduction in cigarette consumption, significant improvement in lung function and quality of life, and less, and this is important, less respiratory exacerbation, which is a very common cause for hospitalization of people with COPD. These are the details of the study. You will see that already at 12 months, people were massively reducing cigarette consumption. Of course, if you massively reduce cigarette consumption, you end up having a progressive improvement in lung function, whereas the control were progressively having a progressively decline in lung function. In parallel, people who quit by switching have a large improvement in quality of life, whereas control were staying stable. This is the impact on respiratory exacerbation, 40% less respiratory exacerbation in people switching to electronic cigarette in this case. And the final theme is absolute health effects of e-cigarettes. Of course, it's very difficult to understand health effect of e-cigarettes in people who previously smoked. So the only way to evaluate the absolute health effects is to study people who vape but who have never smoked in their life. We were fortunate enough to have a small cohort of these subjects, and in a 3.5-year study follow-up, we were able to show that these people had no long-term health concerns. I'm not going to go into the details, but if you want to have more details, I can provide them. This is a much larger study. It's a global study called the Veritas Cohort. In these studies, we are again focusing on vapers who never smoked in their life. And we used again this respiratory symptom experience scale questionnaire to evaluate level of respiratory symptoms. Never having symptoms is expressed as 1. Everyday symptoms is expressed as a 5. So this scale ranges from 1 to 5. And these are the results that we see in this population. Vapors had a 1.61 in terms of frequency of respiratory symptoms compared to control. Control were never vapors, never smokers. So basically, there's no difference up to 3.5 years. And I will skip to that. And this is take-home message. Prevalence of smoking remains too high. Current tobacco control policies alone are not enough. Switching to tobacco harm reduction tools may help people abstaining from smoking. Combustion-free products are unlikely to raise significant health concerns under normal condition of use. This is very important, under normal condition of use. And people using or intending to use this product should receive correct information about their risk and their benefit. Honorable Chairperson, honorable members, I thank you for attention and I welcome any question or comments you may have.
Okay, you might refer to some of your slides, which you might have skipped when you are answering questions, because I know normally lecturers and professors are given an hour to deliver their message. Unfortunately, we were not able to give you an hour here, but there are some slides that are here.
Honorable Chairperson, I fully appreciate and apologize if I was making too much use of my time.
Yeah, but then when you come back to reply to the questions that members are going to raise here now, you might take us back to any of the slides that you think will emphasize your point and take us through that. Honorable members, let me recognize the hands that are coming up to engage with the professor from Italy. I'm waiting. Ms. Machalamba, assist me also to look for the hands. And I see the first one, Honorable Sine. Yeah, there's a very interesting slide there, Professor, but which I'm sure Honorable Sine will ask you that she's very strong on aerobics and bicycles and never smoked. Now you are actually telling us a good story about such people. Honorable Leroux, Dr. Leroux, you are number 2. Ms. Machalamba, assist me. What other hands that are coming through?
There are only 2 hands for now, Chair. The third one is Dr. Litlape, followed by Mr. Mutubatsi.
Mr. Mutubatsi, you are number 4. After
Third one is Miss Murray.
Miss Murray, Honorable Murray, you are number 5. Let me put it down. Murray, number 5. Any other one? Murray 5. Mutubatsi, Litlape 3. 2 is Dr. Leroux. 1 is Honorable Sine. We have 5 for now. Honorable Sine, you are number 1, followed by Dr. Leroux. The third one is Honorable Dr. Letlape. The third is Honorable Mutubatse, and Honorable Mare, you are number 5.
This gadget is failing me, Chair.
Number 6 will be Honorable Kleko. Any other member I'm leaving behind? Okay, none. Thank you very much. Let us start one after the other. Honorable members, I won't come in between. Just answer. Thank you. Ask. Thank you.
Thank you very much, Chairperson, and thank you, Prof, for the presentation. Chair, my first question, Prof, there are concerns from some people in this country that presentations like yours and others who are not from this country must not be accepted and must not be allowed to influence the piece of legislation of South Africa. This country has been engaging in the processing of the tobacco legislation, as far back as 1996 and other years that followed thereafter. Is this the first time that you are in front of this committee in this way, or you've done this before? And number two, what do you say to this notion that your organization and others who are not from South Africa shouldn't have a say in processes like this one? And number three, Chair, have you done any study on the impact of e-cigarettes on young people's health? We see that these products are even more popular among young people. Are you not concerned about the impact on their health too? Thank you, Chairperson.
Thank you, Chair. Good morning.
Am I next, Chair?
Can I just go and reply one by one? Very quickly.
I think the chairperson usually prefers that we answer all the questions and then you answer at the end, but I won't speak for the chair. Chair, can you hear me?
You have to get a pen and paper and write down, because members are going to ask all questions one time. Then you come back.
Okay, thank you. I didn't know the process, so don't worry.
Sorry, Dr. Letlape, you are number 3. Dr. Letlape, for now is Dr. Leroux. Thank you.
Thank you, Chair. Thank you very much, Professor, for your presentation and for sharing those research studies that have looked at sort of the in vitro studies on the impact of vaping versus smoking. I think one of the questions that kind of keeps on coming up, and it seemed like you've done some research into this area. I mean, of course, we don't have sort of 20-year-long studies looking at vaping, and then you mentioned that in your presentation, and so we don't know what the long-term effects are. And I do see that the evidence that you're bringing to us is that on balance, it appears that vaping is significantly less harmful, or certainly less harmful than on respiratory and other aspects. Now, the question for me is also to get a sense of the. I mean, one of the other things that keeps on getting brought up is the harms of nicotine, and so nicotine in itself, of course, there is the impact of nicotine pouches and patches, and so there's tobacco associated patches like snus, which you've mentioned in your study, but they're also the nicotine pouches that don't have any tobacco in them, versus vaping, which is an inhaled into the lungs way of delivering nicotine, versus smoking. And I just want to get a sense from you what the evidence is on nicotine in terms of the long-term effects of nicotine, because snus, as you say, has been around for so long. What are the studies to show to differentiate nicotine being delivered by other methods versus nicotine being delivered by cigarettes? So if you could just give us a differentiation between that, I'd appreciate that. I think that also, I think that there is obviously still some concern about some of the harmful chemicals being produced by vaping. We know that about thousands being produced by smoking. There seems to be a whole lot less being produced by vaping. But what are the harmful products that are being produced by vaping, and do they differ between different products or different flavors, etc., etc.? So just wanted to get a sense of that. And I guess the next one is specifically asking around, you've spoken a lot about the respiratory impact and on cilia and on respiratory mucosa, etc., etc. But in terms of the impact on the vasculature and the cardiovascular risks for patients, have you got any studies comparing those between smoking and between vaping, for example? And finally, if you could just get us a sense of, in terms of, so I do understand that you talk about vaping as a helpful harm reduction tool, and that it would be useful to encourage people to move from smoking to vaping or to nothing at all, obviously, or that's the way to do that as well. But I think one of the big questions we've sort of been discussing is the single-use vapes, and And that does make vaping more accessible. So it does make it easier for people who are smoking to get access to vapes. But it does also make it easier for children and teenagers to get hold of vapes because it's a lower barrier to entry. And so I'd like to hear your perspectives on single-use vapes from a health perspective, and also perhaps a comment on the fact that the UK has banned this single-use vapes in the country recently. That's all from me. Thank
you. Thank you, Professor Pelosa, and good morning. It's Khosi here. I just have two questions. The first question is on the cytotoxicity study, where you speak of 80% reduction in toxicity. Would it be correct that it could be reversed to say that the tobacco aerosol caused 80% damage, whereas exposure to the e-cigarette aerosol or non-combustible aerosol caused 0 to 10% damage? Because it would then make it clear that the effects on the cilia is negligible or very little. Because sometimes 80% reduction, it's very difficult to conceptualize that. So in terms of the alternative aerosol on its own, how much damage does it cause to cilia? And just as a subset of that, I think Dr. Leroux asked it, are there any studies on the vasculature, endothelial cell studies, that you could probably quickly tell us on the cardiovascular side? What are the studies showing at a laboratory molecular level? Thank you, Chair.
No, thanks very much, Chair. And Prof, we welcome the presentation. Let me start here. What is the impact of cessation in Italy? Because I think I will be more impressed with the presentation that gives us empirical evidence of cessation that happened right at the backyard of your origin as a country, so that we can be convinced that in fact you are helping us from the basis of empirical evidence that has been a success story in your backyard. Secondly, we are dealing with the South African situation. Have you bothered to get studies? Because I didn't hear you speaking to our own country or our own continent in terms of the impact and the success or the less success of the e-vaping in our own country. Because for me, it will help if any evidence is presented of the situation in my own country. And I didn't hear you talking to the bill itself, so that you can be able to help us to shape our legislation of what we are grappling with. I didn't hear you talking to that. And why have you not bothered to study, to help us in respect to the bill? If you have, are there any areas that you can identify or lift to help us reach a reasonable conclusion when we sit and present this to the country as an act? Also, you in your presentation, I don't know, it's slide 2, where you refer us to some success stories. I don't know, in the US. You'll help me if you confused me, because later you lift Sweden as a success story, but at the beginning you have spoken about the US, and clearly the US cannot be a country that we can look up to in respect of it having succeeded with regard to the e-vaping as you wanted to present it at the beginning. No, thanks very much, Chair. That would be my question and comment.
Thank you, Chairperson, and thank you for the presentation. Chairperson, my questions is also about the e-vaping. And everyone is making examples of Switzerland that has reduced smoking completely. But my issue that I have is no one is saying clear what is the harm, because like we always say, you're taking one harm to the another harm, because cigarettes is harm and then also the e-vaping is harm. The gentleman said that there's some people that relapse because you get these things the bubble gum, and you get the ones that you can smell and all this. What is the reason that people are relapsing and going back to smoking? Because some of the people are saying that e-vaping is reducing a person to smoke. I just need to understand that whole thing, because no one can give evidence of what is the impact of the vaping. Because on TikTok, you will see different things. People are saying, warn your children not to vape because these are the dangers. People's lungs are collapsing and all these things. So we are confused because there's now no one that can say from all these presentations that e-vaping is safe because of this and this and that. I also would like to know about the studies that was done. And everyone is talking about Switzerland. What made Switzerland to get to the point where they are, where they don't have these smokers. And then what is the research that they can, like the previous speaker was saying, is that what was done in Africa or in South Africa, because we look at a different way. We have a lot of unemployed people. And if you look at the vapes, vape starts from 90 Rand upwards. Where a packet of cigarettes costs you 20 Rand, some of the illegal ones. So if you want to reduce the thing of smoking cigarettes and go to e-vapes, and it is so expensive for an ordinary person that is unemployed, but he's having this thing of smoking, how do you go above that? Because it means that we're never going to get rid of cigarettes because of the cost effects that you talk about the vaping. And my concern is always that all the presentations, they come and they present about all the other countries, but no one has ever made a study of Africa and South Africa itself. So I just need to understand is how is that going to impact into our country and onto this bill at the very moment. Thank you, Jefferson.
Once I get the quietness, I assume that it's me.
Exactly.
Thank you,
Exactly.
Chair. Thank you, Chair. Thank you very much. Good day to all members and guests connected to the platform. To Professor Polosa, I have this to say. I see and hear that from the presentation that he is making. He is introducing an alternative to smoking. To me, e-cigarettes are expensive than normal cigarettes. I agree with Member Murray when he is making a comparison. I think they are introducing another, let me say, another poison in the name of saving people to the other poison of smoking, which is not the case in this bill, because this bill does not prohibit smoking or vaping. It just introduces restrictions to both smoking and vaping. But in his presentation, it's all about introducing an alternative. As a member of parliament, I don't think I would be fair if I can join those that are introducing an alternative to smoking, because the bill is regulating both. I think, Chair, in his take-home messages, in all the presentations, most presentations that we're getting are not from a South African or African experience. So we can't just agree in all what is listed under the take-home messages. We need to get the South African experience before we can agree or not agree. We need to get a South African experience. He is saying e-cigarettes are helping people to quit, meaning they are an alternative to smoking. Wanting to, sorry, Chair.
Are you coming back, Honorable Peko?
Yes, I've come back. Somebody disturbed me, Chair. It's very difficult working at home because there will be people disturbing you. I wanted to come on the issue of these products that vaping companies introduce, wanting to check if they did pass the medical test, wanting to know if the manufacturers have obtained medical authorization. If not, what makes them sure that they are safe? Because they are saying they can produce better health results. I am interested in that. Why are these companies not applying so that there is a medicinal test that they have passed so that we can say they are safe, they can be used by human beings? I wanted to sponsor that, Chair. Thank you.
Okay. Professor Polosa, from my side, I wanted just to get clarity on the following. Some of them have already been touched by my colleagues. This bill introduces a basket of products whose common denominator is nicotine. And you would want probably to say, should we not strengthen the differentiation? In your input, I see you probably going towards that way to say, please differentiate, and I would want to empower you with process that might help you to differentiate, because if people were to move out of smoking, they would have done themselves and their country better, the combustible one. But if they fail to do that, they may lean on something less combustible or non-combustible because of the impact it might have on health, and therefore you are strongly talking about the vapes. Following on the question, maybe you'll probably then conclude if this is part of the message you want us to have, to say, if one were to consider using nicotine, maybe don't use it in a form of cigarette. Consider using it in any other form, vapes being another alternative, and nicotine pouches. I want therefore to check with you, if I were to start smoking at my age, between vapes and pouches, which one would be probably a better one? Because both of them, one would think I'm unlikely to introduce secondhand smokers by taking it, and maybe I'll also be less riskier for me to have cancer of the lungs with either or. But I have not been able to, but being a professor to a level, you might be able to dissect for me that of these two devils, which is a better devil, vapes and pouches, nicotine pouches. Dr. Leroux asked about the single vapes and whether because of the easy access by young people, cheap and all that. And also some of the presenters have indicated to us the challenges with that because of the environmental impact that single vapes have. You probably may not have had this because this is not your area of, you're not in the industry, but maybe you could comment if you can, because if you were to be pushed to allow vapes or some vape, people are actually saying, no, please do allow this vape to go along with vanilla or ice cream or go along with this strawberry flavor. If you don't introduce such very glamorous flavors, you are unlikely to attract customers. Of course, we don't want to attract young customers. If you were to switch from tobacco, which was already on a menthol or mint, you can as well enjoy your vape that is mint or menthol. Why should you then say now, no, give me a vape but that has got vanilla? That's one of the issues I wanted to ask. I was looking forward to your 5-country studies that you probably will touch on one of the countries that have done some work on issues of tobacco in the continent, which is Kenya, and you don't have any information on that part. If you do, can you share with us? Because yes, there's been some advancements in terms of this in Europe and other countries, in Australia and New Zealand, but there is some work that has been done in Kenya. If you also have some information about what they've done there, can you be able to share with this committee? Thank you very much. Then respond to our questions and do time yourself because we still allocate you 30 minutes to wrap up. Thank you.
Honorable Mr. Domo, I'm so very thankful for your sum up, which basically is correct. If somebody doesn't want to give up nicotine, it is best to offer an alternative that is not, I underline, is not risk-free, but is much less toxic than combustible cigarettes. So you're spot on that conclusion, summarizing basically what I wanted to say. Regarding your question of vape versus oral nicotine products, I call it oral nicotine products to distinguish from smokeless, because smokeless is such a gigantic conglomerate of products that may be also very, very dangerous, containing high level of carcinogens, whereas oral nicotine products contains basically traces of nitrosamines. So they are, if you look at the content of carcinogenic substances in oral nicotine products, is basically identical to the medicinal nicotine replacement therapies. I hope this answers your question. So if somebody has to make a decision, my suggestion is, if you cannot just quit on your own cold turkey, try an alternative. If vape is too expensive or you don't like flavorings, try oral nicotine pouch. Or if you don't like oral nicotine pouch, try something else, a heated tobacco product. I think for people who do not want to quit or who cannot quit despite many tries, having an option, it's a matter of human rights in essence. And I'm talking from the aspect of leading a smoking cessation centers. You know, there are people who came highly motivated and yet, I mean, they cannot quit because relapse is one of the major problems in smoking cessation trajectory. So that's the big advantage of having an alternative, which is reduced risk. The alternative represent, in my opinion, but also in the opinion of many other researchers globally, the best relapse prevention tool that we can have. For example, we know that nicotine gums are effective, but as soon as you finish using them, you relapse. So if you allow to use gums forever, you may find a way that to prevent relapse back into combustible smoking. So the concept, in my opinion, is more or less the same. In terms of disposable, quite frankly, I don't like the idea of disposable. The disposable are very much less regulated. There's too much illicit introduction of these products. And of course, they can pollute more than, products that you can reuse multiple times. I think in England, from 1st June 2025, there's been a ban in place for disposable products. And I think we should look closely to the statistics in that country to see what is going to be the impact so that we can learn something about it. Of course, and this is going to reply many of the honorable members in this call, including Honorable Masello Lolo Senne. Of course, you need your own data. You cannot use data from US, you cannot use data from Italy, particularly when it comes to behavioral component of the study, because South Africans are different. Culture is different. The use of nicotine-containing products will be different. So I very much urge you to run your own scientific studies in your own country so that you can base any regulation on your own data. And as COIR, we are more than happy to help you out with designing studies and helping you with statistical assistance or anything else. In fact, we are doing this in Indonesia. Indonesia, as you know, has the highest smoking prevalence in the world. And we are collaborating with the two large universities over there to try and get Indonesian data that can go into the hands of Indonesian politicians. So I'm 100% agree with the Honorable Masello Lolo Senne and with other honorable members of the committee who were presenting concerns about not presenting South African data. I would love to have South African data. I don't have it. I would love to work with you guys on any aspect you may feel appropriate. Going back to Honorable Chairman, he was asking more about the 5 countries cytotoxicity study. I will go back when I reply to Nkosi Lapitepe. I'm very sorry with the pronunciation. I hope you forgive me. But regarding Kenya, I'm afraid I don't have any evidence or any help I can support. I don't know the situation in Kenya at all. So I'm very sorry, but I cannot provide any support, Honorable Mr. Dolomo. Let me catch up again with Honorable Masello Lolo Senne. I think I already answered about the concerns about not presenting South African data. Of course, US data is for US people, so US researchers should stop influencing the tobacco control policy globally by using their own data. Every country should have the right to develop their own scientific, knowledge base, and South Africans should be doing the same. I'm not trying to influence the government of South Africa at all, and I don't think I have the power. All I'm trying to say here, I'm trying to help out. If you think my services are useful to your government, here I am with my whole organization. Regarding a cigarette impact in young people, because of limitation by ethical review board, we are not allowed to study people younger than 18 years old. So it's very difficult to try and understand any health impact in very young people because of ethical restriction. However, in our larger studies looking into respiratory symptoms and some health effect indicators, in younger people, age 18 to 35, in follow-up up to 3 to 4 years, we couldn't pinpoint any important or any health risk at all. Of course, we will need 20, 30 years to see if anything happens, but knowing the toxicology and of combustible cigarettes and knowing the pathogenesis of smoking-related diseases and knowing how much less toxic are non-combustible nicotine-containing products, I would very much anticipate that the risk of developing disease is very much reduced, if not nil. I mean, people will die from other causes. For example, considering the obesity epidemic, the risk of dying for cardiovascular complication from diabetes will be much higher in 10 years than the risk of dying from smoking. I would also like to answer to this question about long-term health effects. It's all about absolute risk. And I think I very clearly emphasize the importance of studying people who never smoked in their life. Why? Because studying people who were former smokers, they have already accumulated damage from previous smoking history. So decoupling this previous smoking history from any eventual risk from vaping will be basically impossible. In terms of people with overt disease activity from smoking, I use the term harm reversal. If I quit smoking and I have already developed a disease, when the disease is still reversible, I can reverse some aspect of that disease. So it is important that perhaps in your strategic planning of science applied to South Africa, you consider also studying people with respiratory conditions or cardiovascular condition who can switch and monitor them to evaluate, as I did in Italy, their improvement in some of their health disease markers, indicators. There was a very interesting question about nicotine and the effect of nicotine per se. Let me reiterate this, and it's not me talking, it's all the major health organizations all around the world. They're stating that nicotine is not cancerogenic, nicotine cannot cause COPD, and nicotine cannot cause cardiovascular disease. At least can aggravate.
continue calling COPD with the full
Oh,
name?
sorry. Very sorry. Sorry. It's chronic obstructive pulmonary disease. It's a very common pulmonary condition that is caused by smoking. Is that okay?
No, I just interrupted you when you were mentioning that with other conditions. I just wanted you to mention that word in full. Yes, then
Yes,
continue.
yes. I'm very sorry. I will try to keep myself reminding myself that you're not expert in the area. So I'll try to make it as simplistic as possible so that you can digest all this information. Okay. So nicotine, for example, in products like oral nicotine products, basically is pharmaceutical nicotine, because nicotine in nicotine replacement therapy, patches, gums, actually comes from tobacco. The nicotine is extracted from tobacco, is purified, sold to pharma industry, and they use it for that purpose. So it's exactly identical. And the level of nitrosamine contamination it's within traces. It's not even measurable sometimes. In terms of other harmful chemical products that they are, for example, generated by vaping in the aerosol, of course, I have to mention formaldehyde. Formaldehyde can be produced by vaping, particularly in case where you are not use vaping as instructed. For example, there are a lot of in vitro studies and experimental studies showing sometimes very high levels of formaldehyde in the aerosol of e-vapor. The reason is that many times in this experiment, they are not using condition of normal use. What that means, if you use a toaster and you want to toast some bread, you have to follow user recommendation to have a nice toasted bread. But if you don't follow user recommendation, the manufacturer recommendation, sorry, you may switch the lever to 10 minutes, highest temperature, and you end up having bread which is completely black, full of carcinogens. This is exactly what's happening in tobacco harm reduction research. There are a lot of scientific groups that they are not using standardized condition for evaluating formaldehyde in the aerosol. Another area that requires more information is about flavoring. Flavoring are classified by the food industry as a GRAS, meaning generally regarded as safe. But these are generally regarded as safe when ingested, not when inhaled. So we really need to do something more in this direction, particularly when we want to assess absolute risk of vaping. Because in terms of relative risk of vaping, I think I showed a slide, and I'm going to also answer to Ngozi Ntlepe. Let me just take this slide so that I can provide correct figures. And Ngozi is correct by stating that by looking at tobacco harm reduction tools, I mean, the worst can happen is a cytotoxicity of about 15%. 15% toxicity by ISO standard is not considered toxicity of clinical relevance. To be of clinical relevance, toxicity must go beyond the threshold of 25% in this particular model, which is used by FDA to approve drugs. So we are using an FDA model to verify cytotoxicity and comparing different products using different labs in 5 different countries. And I hope I answered Ngozi Laptape question. So in terms of endothelial and cardiovascular risk, I thank you very much for asking that question, because we did publish replication studies about endothelial damage using a model which is called scratch test. The scratch test meaning that we scratch the surface of the epithelial cell lining to create a scratch, and then we measure how long does it take for these monolayer cells to repair itself. And we expose the monolayers during the reparation process to smoking, fumes, and aerosols from tobacco harm reduction tools. And the conclusion in our study, which was published 3 years ago and is very highly cited by other colleagues, is that whereas tobacco smoke impairs completely the possibility of reparation of the endothelial, aerosol from electronic cigarettes reduces the reparation by only 10–15%. There is also a very interesting study by colleagues at Aberdeen University looking at the functional aspect of the vasculature. It is called flow-mediated dilation. It's a technique that measures the capacity of the vessel to contract and expand elastically, okay? In that study, which is a randomized control study, the authors have switched people to electronic cigarette and looked at the impact of flow-mediated dilation. The conclusion from that study was that people who successfully, completely migrated to electronic cigarette, abandoning tobacco combustibles, were able to improve significantly, and I mean not only statistically significantly, but clinically significantly, the dilation of on that particular model. Yes, vaping can be used to help people stop smoking, but the trajectories are very different. In my experience, I've noticed people that just take the product and just quit the following day. But these are not all the people that are using electronic cigarettes. There are people that need some adaptation time to the product. And it's a very complex procedure. Many people try different products to find the one that is satisfactory enough to allow them to abandon their bad old habit of smoking tobacco combustible. So when we talk about vapes, there is also a trade-off. The trade-off is about young people that can initiate these products versus smokers that can use this product to completely quit smoking. However, there's data from the literature, of course, not some from South Africa, but this would be a good idea for you, for your good researchers in your good universities to do. There is evidence in the literature that the ratio of benefit versus risk, meaning the ratios of abandoning smoking in adults versus adopting vaping in young people, is basically 9:1. Let me just check. Somebody was talking about backyard success story in Italy. Is that right? I cannot use Italy as an example simply because the rate of transformation in Italy is not very rapid. At the moment, only 5%, 5 to 7% of the population is using tobacco harm reduction tools or nicotine alternatives. So the pool is too little to have an impact on the very wide smoking, tobacco smoking population, which is in the millions. I think in Italy it's about 7.5 million people are actually smoking. However, there are excellent examples in New Zealand and in the UK where the government have promoted vaping, and you can see from their statistical data that comes from their annual surveys that the impact in smoking prevalence is very impressive, in the range of 4 to 7 percentage point in less than 6 years. Very impressive. Of course, you need to do the same in South Africa, establishing an observatorium to look at the epidemiology of any changes. And if you're happy with the changes, and this is the reassurance for the government and for the people of South Africa, these legislation should be reiterated. If there are signs of dangers, the legislation should be revised. In my opinion, what I was trying to say is that the bill should be proportionate to the risk-benefit ratio. One of the problems as a scientist I have today is that most of my colleagues just look at the risk and not the benefit. So how can you construct a risk-benefit ratio if the numerator is so high and nobody is looking at the denominator? That's one of the very big problems we have in tobacco harm reduction science today. But of course, the toxicology is very clear, and I think any legislation should be looking at the relative risk, which is very much reduced when you compare alternative nicotine products that they are not combustible with the traditional combustible tobacco cigarettes. There was a very good point from you, honorable members, reminding me that electronic cigarettes may be expensive, so it may not be an approach useful to South Africa, as it is not useful in Indonesia, as we are witnessing with our colleagues in Indonesia. However, there are two things that we need to consider. There are other alternative nicotine products. For example, oral nicotine products are very cheap, and they can be mass produced by the government locally, so they can help the local businesses to thrive and help the public health at the same time. And another consideration that needs to be done is think of mobile phones in the 90s. In the 90s was a commodity that only rich people could afford. Now, mobile phones are in the hand of anybody, literally anybody. I was visiting a rural area in Indonesia, and they had nothing. Their TV set was similar to the TV set my grandparents had in their house in the 60s. However, they had an iPhone. So try to think in terms of evolution, innovation, and the more people will buy these products, the lower will be the overall price. I think that again, there was a very important comment from one of the honorable member of the committee regarding relapse and going back to smoking. as I said before, vaping or using these products, these alternatives, these substitutes is the best relapse and prevention tool you may have. And that's the reason why smoking cessation rates using these products stay high, because of the substitution. Let me reiterate once again, vaping is not risk-free, but is not as harmful as cigarette, as many other scientists are apparently tempting to say. This is blatant misinformation. And I don't have the time to show you all the counter evidence, and they are in the thousands, but I'm available for any other scientific follow-up you may need in this particular area of science.
You have 1 minute to wrap up, Prof.
I think I'm finished. There's a final remark about the medicinal route. Why tobacco companies are not pursuing the medicinal route? I think you should ask them because I'm not a tobacco company. But in mid 2010, at around 2014, one tobacco company, British American Tobacco, was granted the medicinal route for one of their products. It was not really an electronic cigarette, but it was something similar. So they were granted the product. However, their thinking was from a marketing point of view, this is not going to be a blockbuster because people will go to the vape shop. Mind you, this was regulated in UK only. Okay, people will go to a vape shop, will buy a much cheaper electronic cigarette, and they're gonna have the same end effect, which is quit smoking. So they eventually thought that from marketing point of view, commercial wise, was not a very profitable endeavor. But once again, I'm not in the tobacco business, so I'm not really sure why they did not pursue any further the medicinal route. Don't forget, medicinal route is also super expensive. You require millions and millions of dollars just to present the dossier. And I don't think many local producers or manufacturers will be having the financial ability to do so. And I think I will stop with that. I really hope that I answered all your questions. And Honorable Chairperson, honorable members, I thank you very much for your attention and for the very interesting questions and comments.
Okay, thank you very much, Prof, for your comments and what you have shared with this committee. It will assist us as we put together all views and coming in from people who actually have done some work and collating some research studies that have been done here and there, also assist us to look into that. We welcome you and thank you very much. Are you presenting from Italy, from Sicily?
Yeah, I'm actually on vacation. I'm presenting from Sicily. Yes.
All right. Okay. Okay, enjoy. You can see well you are dressed. It's warm in your country. It's a bit chilly down here. Thank you very much, and we wish you well. And we will interact with you when there are issues that we will want to raise as a committee. And our secretary will be in touch with you. Thank you very much. You are now released.
Thank you.
Yeah. Honorable members in the department and all our officials, let me thank you earnestly for this work that we have done to date. Ms. Majalamba will update me and then we'll share with you how far we have gone. But just to indicate, we will need your attention, we will need your availability again. The next time we meet will be Tuesday, the 12th of August As you would really recall, I made a request to the House Chair to speak to and request chief whips of various political parties that in our constituency period, we be allowed to have some work that we can do. And therefore, they supported and endorsed that it's a legislation that must really go in and out of portfolio committees. This has been sitting with us for some time. We can't process it faster than what we are trying to do. So we still request your availability. On the 12th of August, we will reconvene to continue with the work. I would not recall now how many we still have to do, but we will, if we are available in the month of August, might push quite a lot. And Ms. Machalamba will update us on. Ms. Machalamba, on what time? I'm sure you'll still write it on the group. What time on the 12th of August are we scheduling the meeting?
In August, Chair, all the meetings will start at 3, from 3 o'clock.
Okay. Yeah, honorable members, we have tried to avoid the Wednesdays because Wednesdays are usually days where political parties have some other activities that might go to evenings, by-elections and all that. So we are requesting your 3 o'clock from Tuesdays and Thursdays. And if you do that, honorable members, for at least 3 weeks, we might have a significant impact on the work that we are doing. Have a good afternoon and thank you very much. And bye-bye to all of them, all the members who have joined in and all those who have shared. By just coming in to listen, we also welcome your participation. Thank you very much.
Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Bye, everyone. Enjoy your holiday.
No holiday, work at home.
Or then enjoy your grandchildren.